Hello and welcome to the IGCS Regional Connect meeting that brings together members and guests from Africa and Middle East. My name is Alex Mutombo, IGCS Regional Board Representative for Africa and Middle East. I'm joined today by Dr. Nadim Abu-Rostom, IGCS President-elect, and Dr. David Atala, Secretary-Treasury-elect for IGCS.
Thank you, Alex, and thank you all for joining us today. Our board and volunteer leaders are dedicated to shaping IGCS and ensuring the delivery of impactful programs and fostering a diverse, inclusive global community of members. This is the IGCS team, a dedicated group of professionals that keep the IGCS moving forward with all our work and programming. They make being a volunteer leader at IGCS an amazing experience. So thank you, Mary and IGCS team. And some of them are with us here today. David.
Thank you, Nadim. I am David Atala. I want to thank everyone for joining us. I want to welcome you all to this membership initiative called Regional Connect. It is so exciting to have so many of our members from the region joining us today. The purpose of these virtual gatherings is to bring members of IGCS from the regions closer together and strengthen collaboration and knowledge sharing. These meetings are for you. Meet and interact with your regional board representatives, discuss regional opportunities and challenges in gynecologic cancer care, and allow us all to engage with colleagues across the region and build stronger professional connections. Alex?
Thank you, David. Indeed, this is our members' platform to talk about opportunities and challenges in gynecologic cancer care in your countries, highlighting any new initiative or achievements. Many of you have taken the time to submit questions. Thank you for doing this. And later in the meeting, we will discuss these questions. Before we start discussion, we will share details on IGCS memberships and our benefits. Established in 1987 as a not-for-profit, the International Gynecologic Cancer Society unites interdisciplinary members of the gynecology cancer care team, including gynecologic oncologists, radiation oncologists, medical oncologists, pathologists, allied health providers, and other clinicians and researchers who devote their professional lives to gynecologic oncology research and patient care. The mission of the IGCS is to enhance the care of those affected by gynecologic cancer worldwide through education and training and public awareness. We achieve our mission through strategic collaborations with regional and international organizations, hosting and supporting scientific meetings, promoting research and publications, outreach, and other activities. Just a few words about the IGCS and our membership numbers. As you can see, we have more than 10,000 members from all over the world. For Africa and the Middle East, we have almost 530 members. And you can see the countries breakdown here, with the Nigeria and Kenya representing the majority of our Africa and Middle East members. David.
I'd like to take a moment to recognize our regional strategic alliance partners, the Gynecologic Oncology Society of Nigeria, the Gynecologic Oncology Society of Kenya, the Middle East Mediterranean Association of Gynecologic Oncology, the MEMAGO, the Pan-Arabian Research Society of Gynecologic Oncology, the PARSGO, the South African Society of Gynecologic Oncology, the SASCO. Our regional alliance partner organizations have found their home here at IGCS, an international home to share all the great work happening within their regional society. We welcome other organizations from the region to join us in an alliance partnership, have the opportunity to achieve successful international collaboration with IGCS leadership and industry partners. Just reach out to Mary. Nadeem?
IGCS community. As an IGCS member, you will gain access to a dynamic international professional community along with valuable educational and collaborative opportunities, including IGCS Education 360, which is a comprehensive multidisciplinary online education. It's a really fantastic program. IGCS certificate programs. These are self-guided courses completed at your own pace. Access to the International Journal of Gynecologic Cancer, which has a very high impact in our field. Engagement and leadership opportunities within IGCS. Reduced registration rates for IGCS meetings and events. Global networking and collaboration with peers and experts. Mentorship and training programs. And voting rights and eligibility for board service. Alex?
And one of the newest ways for members to connect with each other and find your community of colleagues is through our networks. IGCS Special Interest Networks builds on the IGCS global community by bringing together members with shared professional interests, regional ties, or areas of expertise. These networks are designed not only for members seeking to expand their knowledge and advance their careers, but also for established clinicians who are eager to give back, sharing their expertise, mentoring others, and strengthening the field worldwide. By joining a network, members will have opportunities to connect, collaborate, and shape the future of gynecologic oncology from every angle of care. We invite you to join the African Middle East Special Interest Network if you have not already. Scan the QR code to join. Nadeem.
Thank you, Alex. The next topic is the Early Career Special Interest Network, which is really a very exciting area. IGCS continues to give early career professionals a bigger voice within our community and empower them to become future leaders. And this is why this year IGCS conducted elections for positions for early career president, president-elect, and secretary-treasurer. The Early Career Executive Committee will play a central role in shaping the future of the IGCS Early Career Network. These newly elected leaders will help define priorities, guide strategy, and ensure the network continues to reflect the needs and interests of early career members worldwide with guidance from the IGCS Board of Directors. Over time, the vision of the network includes the development of dedicated committees led by early career members with focus areas that may include education, networking, advocacy, and research. These enhancements will be introduced in a phased and intentional manner as appropriate leadership structure and staff support are put in place. Our goal is to build this foundation thoughtfully and sustainably. David.
Thank you, Nadeem. Now it's about the IGCS Surgical Film Library, launched in October of last year on Education 360. Is a surgical film library, a collection with over 200 plus films reviewed by global surgical experts, showcases procedures and technique perspectives from around the world. This library is accessible anytime and anywhere. Check it out. We invite you also to submit your film to the library. Information may be found on the IGCS website. Alex?
Thank you, David. We also have added translated closed captions to Education 360, learning portal available in multiple languages, including Arabic and French. Being a global society, this is essential and it allows you to learn everything related to gynecologic oncology in the language you're most comfortable with. Nadim.
Another initiative that IGCS started this year is the GTD ECHO in partnership with the International Society for Study of Trophoblastic Disease and the International Society of Gynecologic Pathology. This is a monthly 1-hour virtual meeting to discuss GTN GTD with global experts who provide case presentations and educational lectures for the multidisciplinary team. If you have not attended, I would strongly encourage you. This is one of the most amazing things that have happened this year. The next ECHO is on August 27. And one of our newest initiatives is also this expanded training programs. These programs are shorter than a full fellowship and are designed to be more accessible, flexible, and affordable, ranging from short surgical courses to observerships and focused research opportunities. These programs allow healthcare professionals to deepen their expertise, gain hands-on experience, and connect across borders. Our programs aim to increase global interaction and knowledge transfer by creating a supporting opportunity for further professional development. David.
Thank you, Nadim. Now we are working also on a new research committee. The committee will serve as a hub for research inquiries for members and partners, develop rare tumor registries to improve data collection and collaboration, identify research priorities aligned with IGCS's mission and member interests, and develop policies and procedures for evaluating research proposals and surveys seeking IGCS endorsement, support, and promotion. By bringing together our diverse and talented membership, the research committee will strengthen IGCS's leadership in the global research landscape and expand opportunities for members to contribute to studies that improve patients' outcome and equity in care. Alex.
Thank you, David. We also have mentorship programs. IGCS mentorship programs aim to bring together members from high and lower resource settings to share knowledge and build long-lasting relationships. Our programs aim to increase global interaction and knowledge transfer by creating and supporting opportunities for further professional development. David.
Thank you. What about the journal? We have our International Journal of Gynecologic Cancer, and it is the primary educational and informational publication for topics relevant to detection, prevention, diagnosis, and treatment of gynecologic malignancy. IGJC emphasizes a multidisciplinary approach and includes original research, clinical trials, and translational or basic research, reviews, and also video articles. We recognize the importance of assuring that our journal represents the work and the research being conducted in all regions of the world, and at the same time that it also highlights key issues critical to patients, not only in developed countries, but also in low-resource countries. We are proud to share that the International Journal of Gynecologic Cancer impact factor is 5.4. Nadim?
Thanks, David. And we're very happy to announce that Dr. Renee Perea has been named the next editor-in-chief of the journal, following an international search led by both IGCS and ESCO. Rene is a gynecologic oncologist based in Colombia. He's practicing at the Astorga Oncology Clinic in Medellin and the National Cancer Institute in Bogota. Dr. Perea has served as a journal associate editor for the past 7 years. He's authored more than 160 peer-reviewed publications and 10 book chapters and reviews for over 20 Web of Science index journals. He will officially assume the role on January 1, 2027, working closely with the current editor-in-chief, Dr. Pedro Ramirez, during a transition period beginning this month. And has said his vision is to elevate the journal as a leading platform for high-quality evidence that impacts patient care while amplifying diverse voices in gynecologic oncology worldwide. So this is great news for us. In addition to all these member benefits, it's a great pleasure to invite you to the upcoming annual global meeting to be held October 1 to 3, 2026 in Montreal, Canada. Led by co-chairs Dr. Paul Cohen and Dr. Anna Okinen, the IGCS 2026 Scientific Program Committee has developed a multidisciplinary program representing all aspects of gynecologic surgery, medical oncology, pathology, radiation, nursing, and more. As you have come to expect, the meeting will encompass a diverse range of topics and perspectives, ensuring an in-depth exchange of ideas and knowledge of gynecologic oncology. The full program is now available online, and we encourage you to check it out and hope to see you in Montreal. Alex.
Yes, we encourage you to join the delegates from Africa and Middle East Special Interest Network meetups during the IGCS 2026 Annual Global Meeting in Montreal. The meetup will allow time to exchange ideas and build relationships that continue long after the meeting. Whether you are looking to expand your network, discuss the science presented at IGCS 2026, or explore opportunities for collaboration, these meetups will help you make the most of your time in Montreal. Mary.
Thank you, Alex. I just wanted to spend a few minutes talking about our Access program. And most recently, last year, we were in Africa. This program follows our annual meeting around the globe and really addresses looking at accelerating cervical cancer elimination and strategies for the region. We had a really stellar group of faculty led by Dr. Suzanne Garland, who many of us know as part of the HPV vaccine. Dr. Karen Canfell, who's very involved in the EPIC programs, led Pillar 2, screening, treatment, and precancerous, and then Kathleen Schmaler, who runs leadership in our mentorship and training program. So we followed the pillars of the WHO and then invited local faculty to be a part of this as well. Dr. Isaac Adewale was our moderator for the day. I think many people in the region know Isaac, and he really helped us get a deep dive into the current situation of cervical cancer elimination in Africa, and we're grateful for his continued presence and contributions to the program. Basically, when we walked away from the Access Africa program, the insights that we took away are here on this slide, that elimination is achievable, that current efforts are a little bit fragmented, and that is not uncommon and very siloed within the pillars, and that really building partnerships with community leaders, the civil society, and people with lived experience in the region can only lead to further success. And we have, hopefully, IGCS members will support this Access vision and will feel empowered to help advocate for elimination in their own country. The baseline for the 5-year drive for the National Cervical Cancer Elimination Plans and Strategy is outlined by WHO AFRO, which is the regional office within the World Health Organization. So only 5 of the 47 countries in the region have what we would consider to be a cervical cancer elimination plan or strategy. So we look to hopefully help improve this through a portal that we've invested in with the ICCP, looking at providing resources that will be helpful in mapping and other regions of Africa develop these plans. What we've done post-Access Africa is we've developed an IGCS member toolkit. Soon there'll be a publication on our proceedings and findings from the day that we spent discussing a cervical cancer elimination. And then a 5-part webinar series we're doing in partnership with the ACHA and Aortic, focused on best practice sharing. And starting in September, this will take place. And then we continue to do podcasts. So if anyone in the region is interested in conducting a podcast with us, we'd certainly welcome that as well. And then this is, Alex was also involved in our efforts. And one way that people can help is sign up as a partner, supporter, or leader and help us in the movement to eliminate cervical cancer in Africa. All government agencies within Africa recently received a letter about the map, about the resources for developing cancer control plans. And we have a template, if you'd like to use that, to reach out to your local ministries to get them more engaged in the elimination. Another way to help out is join a social media campaign, the NCD Alliance. The first week of September, we'll be doing a big push in social media on one fact, one app. So you can create your own social media toolkit and use that to help drive awareness as well. Julie Tarode has been instrumental as our consultant in helping us continue to not only support the Africa efforts, but fully develop our program for Montreal, which is the North American based program. As you can imagine, the differences in regions of the world, but so many of the problems and challenges are germane to everywhere in the world. So I hope that you all will consider getting involved. Reach out to me if you want to become more involved. I know all of you, your priority is to eliminate cervical cancer in your region. So thank you.
Thank you, Mary. I'm going to speak about the World of Hope. IGCS World of Hope is a global fundraising and development campaign. It's an initiative designed to improve care for women with gynecologic cancers worldwide, especially in countries where access to treatment is limited. It raises funds to support training and mentoring of doctors and healthcare professionals, expands education program in low and middle income countries, helps efforts to prevent and eliminate cervical cancer, promotes equal access to quality cancer care regardless where a woman lives. Nadine?
Produced by for IGCS by the BBC Storyworks commercial productions, this short film tells the story of how local training, international mentorship, and long-term partnership are helping transform cancer care in Fiji. Around the world, too many women die from gynecologic cancers that are preventable and highly treatable when specialists' care is available. Before the IGCS Gynecologic Oncology Global Fellowship Program was established in Fiji, physicians seeking specialist training had to leave the country. Today, Fiji is training its own specialists. This film follows Dr. Nanis Sekiti, the first physician to complete gynecologic oncology fellowship training in Fiji, alongside one of her international mentors, Dr. Ai Ling Tan and Dr. Yunaisi Taboa, the second physician now training in country. Their story demonstrates the impact of the IGCS fellowship. Investing in local expertise strengthens the healthcare workforce, expands access to specialized care, and creates a lasting ripple effect for women, families, and communities. While filmed in Fiji, this story reflects the work being carried out across all 23 IGCS fellowship training sites worldwide. And this is really an amazing film that everyone should watch. Alex?
Thank you, Nadim. Now, I want to conclude this portion of the meeting by encouraging many of you to give some thought to getting involved in IGCS. Find a way to connect, contribute, and make a difference, no matter where you are in your career. You can become a mentor or support colleagues in lower resource settings through our new Expand training program.
Okay, so I think this is the portion now where we are going to look at some of the information that was provided to us through the registration portal. So I think maybe we Alex dropped off there for a minute. So I don't know. First of all, we want this to be open dialogue. So whether you contributed to this information or you have other questions that you want, we certainly encourage some type of dialogue now. I think a lot of this is probably clinical care questions, which we would encourage you to go to our learning portal, a resource for articles in our journal, potentially. I know the GTN Nadim highlighted the trophoblastic tumor board, and the next one being next week on August 27th. A great place to learn and to better understand the management there. Anything else stick out, Nadim or David, that we want to highlight?
I would reinforce what Mary just said. For GTN issues, there's probably no better platform nowadays than the monthly meeting that we're having. It's really phenomenal. When you look at the bucket of cervical cancer prevention and screening, I think IGCS has a lot of material on that that could also be very well accessible to you online. Networking collaborations across Africa and the Middle East, we can do more. I think we're trying very hard to connect with the region, with North Africa, with the Middle East, and with the Central and Sub-Saharan Africa too. But we're open to any suggestions that you think would help us strengthen the network for the region. David, I don't know if you have any comments regarding networking and collaboration.
Yes, exactly. I fully agree with you. It's the GTN platform is really a chance for everyone in this region to get in. Moreover, I would like to benefit from you as president-elect and future president in developing the endometrial cancer here in management in the Middle East and the escalation in the surgical management in endometrial cancer. It would be a great opportunity if we can do something. You are the expert and trying to expand this way of managing endometrial cancer in this part of the world. It would be a great opportunity because many of our patients are not benefiting from sentinel lymph node, from the know-how, and maybe we can expand with your help this management in our part of the world where endometrial cancer is the first cancer in women.
Thank you, David. So, Dr. Al-Rubaish, can you please speak a little bit more on, because you're asking, can we create social media in Arabic in the Middle East? Is this patient-directed, specific educational activities? Can you please speak a little bit more on that?
Yeah, hi. Thank you very much for the meeting and highlighting the needs of the area. Yes, I'm talking about actually there is individual effort in our region focusing in patient education, knowing about the international guideline. Even the patient, they need to believe in us and they need to know that we are following what's happening in the world. So, but we cannot speak with them apart from the native language, which is the Arabic, or in other area, for example, in South Africa, some area they speak in French. So how we can get it accredited by IGCS, so the people, they get the trust that it is supervised, it is collaboration, we can trust our people, which we hope to get.
And it's educational material for patients. For example, a booklet on ovarian cancer, a booklet on endometrial cancer. Is that what you're thinking, or something online?
Sometime what I'm thinking about it is an education material about HPV vaccine, Pap smear, the schedule for the Pap smear. It can be like a webinar, it can be like educational material, as you mentioned, booklet, but we can utilize the IGCS logo, take photos like this, but it has to be approved by the IGCS, because they cannot utilize any material related to the IGCS without a permission.
Mm-hmm.
So Mary, patient resources, what can we do with that? Can you help us?
Yeah, we have a directory of for our IGCAN, which is our patient network. There's a directory, and we can look into that directory and find possibly other patient organizations in the region that are doing work that may have translated patient materials, and connect you with them. We don't specifically develop this level of patient material, but we can certainly find some in your region, Sarah, and get you connected with them, because I definitely understand the problem.
And I also don't want to volunteer, but as you were talking about this, I know the NCCN has translated many of its patient material, and Mary and I are working with them. So this is something we can bring to the NCCN to see if we can share Arabic translated patient educational material through IGCS with collaboration with the NCCN. But I think it's a great effort, and we can work on that with you. Dr. Ismail? You're muted.
Good afternoon and good evening for everyone. I see this is Nadim. This is a huge effort IGCS is doing all over the world, but still we cannot go through the bridge to Africa itself. It cannot be believe that 5 countries only from 47 in Africa, they are sharing on cancer elimination. I don't know, should we go physically more to Africa? Should we have some centers in Africa to implement and to educate as a campaign from all over the world to go to Africa itself more physically? Because I see this is, I will talk about myself, maybe we are lazy a little bit, we need more effort than the other. And if I am comparing this is Latin America, they are achieving a huge success. And we are still far away from achieving the goals of IGCS. I don't know, what is that effect? Where is that effect exactly?
I think you're raising a good point, and Mary and the board and I have talked about expanding our board and to get more representation, because you're right, the globe is massive, and the amount of representatives that we have now are doing the absolute maximum. But we probably need more people. We need more champions in Africa. We need more champions in the Middle East, more champions. And Mary and I have talked about this with the board, and I think the board looks at this favorably, but it's a step process. The fact that you bring it up now is also important. It really re-emphasizes the point that we need stronger and more manpower representation of IGCS. And I think this is the vision for us to do that. Hani Bota? Hi, Hani.
Hi, good evening, colleagues. I just want to sort of say that the fellowship program that's running in many places in Africa is producing a new cadre of young, upcoming gynecologists that will make a big difference in the next decade or two. I think through the IGCS fellowship program, the impact will be seen definitely in terms of policy, in terms of capacity to provide clinical services, surgical expertise. So I think the IGCS has made an impact, but that impact will only be visible and more visible over the next decade or two. So I do think there's a lot happening already. What we need in Africa is not necessarily people coming from other places in the world, but is to build the capacity here where people live and work every day.
Thank you so much for saying this. This is really encouraging, and you're absolutely right. It's just a matter of time. Dr. Lawal, Kudus?
Yeah, good evening. Thank you for having me. Yeah, I just want to speak to the need for us to build capacity to participate in clinical trials in Africa. Yeah, I was saying that there's a need to build capacity for clinical trials in Ghanaian oncology in Africa as a whole. When you look at many clinical trials carried out in Ghanaian oncology, you see that participation from Africa is very, very limited. So there's a need to build capacity of sites within African region to be able to participate in clinical trial, and there should be an active push to ensure that African nations are involved in clinical trials that are going to be done in Ghanaian oncology. Yeah,
Thank
and I just want to add my, yeah, okay.
Thank you.
So just to add my, just to add my words to what Professor Bota mentioned, that there is increased number of trained persons within the African region, and they will be able to participate in clinical trials if capacity is built. Thanks, and over.
So this there's a follow-up question on research. Maybe David, you can take that. It's regarding if we can do research through the umbrella of IGCS and whether IGCS has a red cap. Of course, it's a very broad question, but maybe David, you can give a little more update on how the research is moving with IGCS.
Yeah, sure. Thank you, Nadeem. Indeed, we have our new research committee that is being implemented at the IGCS, and this research committee has a purpose to develop new research project. And as we have said in our presentation, it is dedicated for you to submit your research, either questionnaires, either research idea or research question that will be reviewed by the committee and will be scored. And if it passes, it will be the project that will be adopted by the IGCS. Your project will be adopted by the IGCS, and this project will have the opportunity to be presented at our Congress and published in our journal.
Thank you, David.
I think, Nadeem, if I could just say regarding the clinical trials, I think, of course, the ultimate goal would be to do prospective trials in Africa. But I think one step we're making forward now is this pragmatic trials that we're doing within the Early Career Network, and also having a session at the annual meeting on pragmatic trials. So it may be that we have to scale up and ultimately get to phase 3 prospective trials. But for now, just learning, some of the basics behind the pragmatic trials and what's doable in the resourced areas, I think is a good step forward for us.
Totally agree, Mary. And Mary's talking about something that's happening with the Early Career Network. I think it's on a Wednesday just before the meeting starts. So, Dr. Ellen Mensah.
Yeah, good evening from Ghana. So I actually want to talk about the allied health space. So we see a lot of fellowships for the Ghanaian oncologists, the surgeons, and then the medics. But with regards to the allied health space, there's growing need for us to also build capacity here, especially with the physiotherapists, the comorbidities that arise from the surgeries and the radiotherapies. And so if there could also be observership and fellowship programs for the allied health, so that we can also increase the professionals in that space and be able to supplement the works that the surgeons do. And then we can also go into other areas. I'm into Ghanaian oncology, and then I'm a physiotherapist, and I've started a few works in the space, but then some people are interested as well, but then there are no materials, there are no fellowships for us to join in. So if you could consider us as well, and then through your fellowship and observership programs, it will greatly help Africa for us to also build the scope in Africa.
I think it's a great point. Thank you for bringing it up. I know that Dr. Al-Nayami is working with Dr. Sami Ismail on these observerships, and we said these are not just surgical observerships. They could be observerships in exactly what you just said. So as this program rolls out, we would hope that people with the same interest that you said would apply, and they could be matched to the appropriate places. So thank you for bringing it up. Dr. Khadija Warfa.
Good morning, good evening, everyone. My concern is the doubling up of what we do. So we work with the NCCN. We've harmonized all the gynae oncology guidelines. So there's information, there's data on the NCCN. So the question is, how do we disseminate this through the IGCS to have more members learning about what the work has already been done, so that we don't keep repeating ourselves? Thank you.
Yeah, thank you so much for bringing it up. I can tell you, and I promise you that Mary and I are working very, very closely with the NCCN. And it's exactly what you said. We're trying to take these regional harmonized guidelines, and Mary is working very close with the leadership of NCCN to really build a stronger relationship, so we can do exactly what you just said, figure out a way to disseminate all of this so we don't duplicate and redo the work. IGCS is not a guideline society, but we have a massive platform of expertise. And I think the partnership with NCCN, you will see this will evolve more and more shortly. Dr. Bassel Refki. I'm sorry, Mary, go ahead.
No, just to Basil's comment in the comments is more governmental approaches needed. I think this is part of this NCCN guideline development. So we just piloted adaptation process in the Philippines, and part of the team was their Ministry of Health. So I think as we start new training programs, we need to get the ministries of health involved from early on. I think part of the NCCN guideline, I think doing research in country, we should certainly find a way to communicate with the government and ministries of health. I think we have to be more proactive. I think that Henny Botha's point earlier, that capacity will come the more that we do in the country and make the country aware of that. So I didn't want to miss that opportunity, Basil. But I think you're next, Basil.
Yeah, thank you. Good night, good evening, Mary, David, Nadim, Alex, all our friends. It's exactly, I'm echoing what Mary have said. It's about the governmental approach. For years, we have been approaching individuals. Some individuals are very good, some are active, some are not. But for this region, mainly in the Middle East and North Africa, I'm speaking, you have to approach the governments. The governments like to be approached by the international society. They are very approachable. You can approach them easily. They like to have connections with the international societies. Meanwhile, if you want to implement policies, you want to do something on the real earth away from the training program fellowship, we can do this through individuals. But if we want to eliminate cervical cancer, to do policies, to do global training programs, this can be or should be done through the governments, through ministers of health, or from the governments in this region.
Thank you, Bassel. Dr. Isam Lataifi.
Good evening, Nadim. Good evening, David, and good morning. Hi to everybody. Thank you for this chance to talk about our need in the Middle East and in particular in Jordan. Now, I would join my voice to the clinical trial participation. This is already said by the other colleagues. The other two things, we used to have a collaboration with the IGCS before as a co-partner or partner in our regional and let's say national oncology meeting. That's to say, they used to sponsor 2 speakers from the IGCS. They nominate 2 speakers, or we can nominate them, and they approved to sponsor them at least for travel. Because, sometimes it's very hard for our society to sponsor these speakers. And we are in bad need for their expertise to talk and to participate and to add the logo of the IGCS to the let's say, to our meeting. This is number 1. Number 2, the other thing, I remember there was what we call it tumor board, IGCS tumor board, but I'm not sure if it's still running or not. My suggestion, just to discuss the rare and the challenging cases, at least monthly, as the Eurocan did. They used to collect the cases to discuss them pathology, medical oncology, and let's say expert opinion in that field. So these are my suggestions, and thank you.
Thank you, Isam. The tumor board is still happening, and I think we just need to recircle with you to make sure we disseminate this to our colleagues in Jordan and the region. It's definitely, David, maybe you want to speak on that.
Yes, thank you, Nadim. Exactly. We are doing a monthly tumor board with the MEMAGO and the monthly tumor board with the PASCO. So from the region, from the MENA, the Middle East, North Africa region, you have 2 tumor boards that are running each month. And there are other tumor boards that are being held with the other African nations society. So from the region, I think, correct me, Mary, if I'm wrong, maybe we have 4 tumor boards monthly or something like that with ECO, not counting the GTN also that's run in this part of the world. So maybe, sometimes we are missing the opportunities or we are missing the mails, but the tumor boards are here and you are free to join. There are a lot of persons, maybe from Jordan also. The Kais is joining. So you have a lot of opportunities to expose your cases, and it's your platform to expose your cases and to give us also your opinion on our cases. That's important for us.
But I didn't remember I received any email for the last, let's say, 3 months. It was before, yes, but I didn't have any email in the last 3 months
Maybe
about these tumor boards.
We are
Yeah,
sorry
we'll
for
follow
that.
up on that for sure.
We need to readjust it.
Yeah, Susan,
put
Ralph, in the chat. I'm sorry, Susan, go ahead.
I was just going to say, if you want, I just put my email in the chat. Feel free to email me and I'll make sure to get you on the list.
Please do that, Isam. It's very important for our colleagues in Jordan. And as far as IGCS participating, so I would say, if the Jordanian society, I know I'm coming to your meeting next week and I'm honored to be there, but I think in the future, if the Jordanian society has a meeting, please send an email to IGCS, to our CEO, so we can discuss this at the board and see how we can support, because we've talked about this as a board and we do want to support. So if we get a letter from the society, we would always consider and figure out a way to see how we can help.
Okay.
Gabe, nice to see you. Dr. Levin.
Hi, Mary, Nadim, David, thank you so much for doing this. Nice seeing you again. I would really like to contribute whatever I can do in the research committee. Hearing it from David, it's a great idea. If I can be of any help, or even some local initiatives, if I can support or lead, whether those who don't score high enough to be supported by the IGCS, I would love to participate and see how we can support smaller studies, those who are maybe would be scored lower, and see how we can lead it.
Excellent. Thank you.
And I think, Nadim, our new board member is present. Asa?
Yes, I saw her with the flag, which is very patriotic. But let me see.
Thank you.
I can. Here you go. Okay. Nice to see
Hello.
you. Congratulations. I like the flag. I guess we should do that.
My Tunisian flag. Thank you. Thank you for all of you. And it's a very good regional connect reunion meeting. So I'm noting some point to the future project. I hope that we can improve quality of care and quality of life also in our region. And I look forward to contribute and to help to improve all of this and work all together to improve this in our region. Thank you.
Thank you.
Amazing.
Anything else from our ambassadors? Mary, what else?
I think this has been fantastic. What a great turnout for early evening for some of you. I really appreciate the staff's support in pulling this together. I think these are amazing ways to connect, to get to see each other, ask questions of the leadership, and we will continue, obviously, to do these moving forward. hopefully you're finding your way through IGCS, you're finding your people, if you will, and ways to connect and stay engaged in what's an ever-growing society. So we're really excited.
And if you feel you're not getting information or there's a gap, just email us personally too. We'll try to find the best contact for you in IGCS to make sure you get that information, whether it's tumor boards or you have a question or you want anybody to participate in a meeting, just please reach out to us and let's figure out how we can work together and help. Thanks again to all the staff with IGCS, amazing team.
Great. Thank you, everyone. Thanks for joining.
Let's get a group photo, Mary, before we all jump off. If everyone can turn their camera on, we'll get a group picture for social media.
Oh, I love that. Look at poor Henny. It's still winter there, isn't it, Henny?
All right, 1, 2, 3. We're good.
Thank you
so much, everyone.
Thanks,
Bye-bye.
everyone. Have a good rest of the week. Nice to see all of you.